The objective of this lesson is to become familiar with the types of denture bases used in removable partial dentures, and to understand when they are used. You should also be familiar with finish lines and tissue stops. The base rests on soft tissue, preferably keratinized, which is firmly attached to bone. Bases covering movable alveolar mucosa should be adjusted so as not to impinge on the tissue and function. The base usually provides the attachment of the artificial tooth replacement and soft tissue simulation.
There is no such thing as an ideal denture base, but if there were an ideal base, it would possess the characteristics found in the list above. Bases are of two types of materials. The acrylic base is dotted in red. Each type possesses characteristics of the ideal, while lacking in others. Which characteristics of an ideal base are realized with a metal base or with an acrylic base? When are acrylic bases normally used? When are metal bases generally used? Altogether, the tissue response, maintenance, and durability of the metal base is superior. It is used on short-span, well-healed ridges. If one anticipates that aesthetics is of paramount consideration, or free-lining the denture seems likely, acrylic bases are preferable.
Ideal characteristics of acrylic are listed. It is important to note that acrylic gains strength from bulk. It cannot be used when space is limited. Usually a minimum of 5 mm inter-arch space must exist to use an acrylic base. The example shows acrylic bases. Bases require a certain amount of space. Insufficient space in the example is evident. Acrylic bases are also subject to a certain amount of distortion related to strain from curing. Acrylic is used in extension base cases, areas which require periodic relining, areas when aesthetics is important, large defects and long tooth-borne areas, in which some support from the soft tissue is needed. The big advantage: it is easy to adjust, repair, or replace.
The denture base contributes posterior support in the distal extension case. Biting forces on the base consist primarily of compression. To prevent undue pressure on any one small area, the base needs to cover as much of the supporting tissue as possible. This is referred to as the snowshoe effect. By having a broad coverage base, force per unit area is minimized. Acrylic bases are the default option for all distal extension partial dentures. The acrylic base is added to the casting in a separate procedure. This acrylic is molded to and retained to the framework by a ladder or a mesh in the extension base case. Ladder acrylic retainers are actually a form of minor connector. The ladder attaches the base to the major connector. There should be room under the ladder mesh to allow the denture material to be sufficiently thick to resist fracture. The ladder should be designed such that it overlaps both buccal and lingual slopes of the ridge. Ideally, the ladder is segmented at about the width of the artificial tooth that will be placed there. The above example shows insufficient space for acrylic beneath the ladder. This will prevent the operator from being able to adjust the acrylic. Part of your framework inspection is to ensure that there is room under the ladder for acrylic. There must also be room for artificial teeth when the patient closes. This diagram shows a metal base. It is best used in short, well-healed areas that will not usually require relining. It is useful in areas where inter-arch space is limited. Acrylic soft tissue simulation and teeth are retained by small beads. Also, metal posts or other cast components may be used to retain acrylic. In the illustration, the very small modification space is too small for beads. A post is used instead. Metal has many favorable characteristics as a base material, as listed above. Its strength allows it to be used when in very close spaces.
Metal teeth may be used in a variety of ways in the RPD, such as pontics in small spaces and overlay teeth. Finish lines are areas on the framework which meet the acrylic. They consist of internal and external finish lines. These finish lines are approximately 90-degree joints where the acrylic base terminates on the surface of the RPD metal framework. This allows the acrylic to be finished without thinning. The metal resin interface has the potential for a space which may enlarge as a result of thermal cycling, causing discoloring and retaining debris.
The RPD framework is designed so that the ladder is approximately 2/3 the length of the ridge to be restored. It usually terminates in the area between first and second molar. It always terminates in a tissue stop. In the maxillary, the base framework is extended to cover the tuberosity. The illustration also shows where the external finish line of a palatal base should be. Underextending prohibits proper contouring of soft tissue. Overextension weakens the framework. Please note the location and purpose for the tissue stop, which should be present on all extension base RPDs.